This lecture recording is going to be over meningitis. There are a number of different causes for meningitis, and we're going to talk about a few of them, but we're going to spend most of our time on bacterial meningitis, which is the most common type of meningitis. Meningitis is essentially inflammation of the brain and the spinal cord, and if you can see the picture here on the right, I know it's a little pixelated, but I wanted you to be able to see the inflammatory response of a brain that is infected with meningitis. There are bacterial causes, viral, as well as fungal and parasitic causes, and there are even toxins that can infiltrate the blood-brain barrier and cause inflammation of the meninges of the brain and the spinal cord. We can have acute, subacute, or chronic meningitis. Bacterial meningitis is the primary type of meningitis that we see. It is usually an infection between the pia and the arachnoid matter, and it can also move into the subarachnoid space, the ventricles, and infect the cerebrospinal fluid. As a matter of fact, when it gets to the cerebrospinal fluid, this is one of the ways we can make what is called a differential diagnosis by looking at that cerebrospinal fluid and seeing what's in it. The most common cause of bacterial meningitis is Neisseria meningitidis, and there's also a strain of strep called Streptococcus pneumoniae that can actually cause meningitis. One of the things about Streptococcus pneumoniae is this is part of our own bacterial flora. We carry it in our upper respiratory tract. And when you have people that are suffering certain immunological disorders or are immunosuppressed, this Streptococcus pneumoniae can actually leave the top of the lungs and migrate its way up through the rest of the respiratory tract, working its way up into the brain and causing meningitis. This occurs predominantly in areas of overcrowding. We're going to see, because Neisseria meningitidis is highly contagious, and when you get this overcrowding, one person can infect and then it gets passed to another person, and its infection rate is extremely high. You're going to see it in places like college dormitories, military barracks as well, and in prisons. And so we will see epidemics every so often, usually in a cyclic type of a infection rate. These epidemics will happen, generally speaking, once every 3, 4, 5 years, depending on the type of meningitis. It's been quite a while since we have seen a meningitis outbreak in the United States. We can have acute meningitis, which is believed to be limited solely to the meninges. This produces a number of different symptoms. The number one symptom is fever and a generalized headache. We can also have some issues with clarity, not being able to think very clearly, general aches and pains, as well as a sensitivity to light and neck stiffness. The neck stiffness and fever are the ones that tend to get everybody's attention right away because those two in combination tend to be a good indicator of infectious acute meningitis. Acute meningitis is usually caused primarily by a virus, and you can also have it by inadequately treated bacterial infections. Fungal meningitis is another type. This is usually caused by a fungus that is breathed in from the environment. This can also lead to chronic meningitis because fungi grow very, very slowly. This is very uncommon. We don't see it, but usually in people that are immunosuppressed. Some of the clinical manifestations of our meningitis, of bacterial meningitis, are going to be fever, tachycardia, chills, and petechial rash. But then the rest of them we can group into what we call meningeal signs and neurologic signs. So along with these kind of generalized symptoms like fever, we're going to look for those meningeal types of symptoms as well, which include severe throbbing headache, photophobia, that rigid stiffness in the neck just below the skull, which is called nuchal rigidity. And then we're also going to start trying to discern some neurological signs as well. Decreasing consciousness, the longer this meningitis continues, the more probability that you're going to have with this decreasing consciousness. Cranial nerve palsies, a lot of times you'll see issues with speech, swallowing, those kinds of things where the cranial nerves have become involved. And then in some instances, seizures. Symptoms for aseptic meningitis are similar to those of bacterial meningitis, but they tend to be a little milder. The headache isn't quite as severe, the fever not quite so high. You still do have the stiffness in the neck, but very rarely do you see any loss of consciousness or any kind of seizure activity. Symptoms for fungal meningitis, these are because fungi grow slowly, they're going to develop slowly. The first manifestation or the first symptom a lot of times that you'll see for fungal meningitis is kind of a slipping into dementia. Now this dementia is not permanent. Once the meningitis has been dealt with, you may still have some issues of dementia-like behavior, but eventually things will reverse. Communicating hydrocephalus is another symptom for fungal meningitis. Hydrocephalus is fluid in the cranial vault that doesn't get reabsorbed. So when you have what's called communicating, meaning that there is no obstruction within the cerebral spinal fluid pathway that is stopping that fluid from moving. The fluid is moving just fine, but usually with fungal meningitis, what happens is the cerebral spinal fluid is not being absorbed back into the brain, back into the spinal cord, back into the blood flow, so it's beginning to accumulate then in the cranial vault. Diagnosis of bacterial meningitis is going to be based on physical examination. Once they've established that we have a potential for meningitis, they're going to then do a nasopharyngeal swab, and they're going to gram stain that and look and see if there are any active bacteria in that swab. They're also going to do an antigen test, which is also going to look for that bacteria. In most cases, they will do what they call a spinal tap or a lumbar puncture and pull out a sample of cerebral spinal fluid and look to see what they have in there. This is going to give them the differential diagnosis that will determine between bacterial, viral, or fungal meningitis. Treatment for bacterial meningitis is going to be antibiotic therapy and supportive care, taking care of any kind of respiratory issues or anything like that. Treatment for aseptic meningitis will be with antiviral drugs and steroids, again, to try and deal with some of the symptoms that you see that come along with a diagnosis of meningitis. There is a vaccine available for meningococcal and pneumococcal meningitis. If you're going to be going off to college and living in the dorms, one of the things that they're going to require from you is this vaccine so that we can control any kind of potential outbreak that you have in that kind of a setting. Okay, that's it for meningitis. Again, as always, send me any questions that you have and we'll get them answered.